Welcome. I'm sorry I can't be with you in person today, but I've been asked to just record a kind of a short presentation about the different eligibility areas in special education under Indiana's Article 7 law. So I'm going to go over each of those. My name is Angie McKinney. I'm a school psychologist by background. I am also a technical assistant specialist with the IEP Technical Assistance Center, which was formerly the Indiana IEP Resource Center. We have a new name and a slightly different focus, but a lot of what we do is still the same for those of you who might have used our services in the past. So I'm going to start with just talking about Article 7. And again, I know many of you, this is a refresher, and it should be a refresher, but Article 7 is Indiana's special education law, but it's based on the federal law, or IDEA, or IDEIA, which was the latest revision of that. But states are given the opportunity to kind of follow the federal law, but make some slight interpretations or some labels, or just how they word and enact those different things. They have a little bit of freedom. So if you're talking about the stuff that I shared today about the different eligibility areas, it may be slightly different in different states. So especially for some of you who may get some students who come in from Kentucky or Illinois, based on where you guys are located, it may be slightly different. And it's important that we always review any information for a student as they come in to make sure that it fits with Indiana's interpretations of these different eligibility areas. If not, those are those situations where we need to reevaluate and check things out to see if they fit into that category or a different category. Now, every eligibility area that is identified under the law has certain criteria as far as the kind of things that have to be evaluated, as well as what the results kind of need to look like in order for a student to be eligible. But if a student has an individualized education program, they have to be eligible under one or more of those categories. Otherwise, they don't qualify for an IEP. So we have lots of kids that come in with outside diagnoses. Doesn't necessarily mean that they qualify for special education. It has to be that we take the information that we know about the student, and it has to align with one of the eligibility areas in order for it to be eligible under Indiana's law. So here are the eligibility areas, and you'll see if you count these up that we're always told there are 13 eligibility areas. That's sort of true and sort of not true. We do have these 13 categories, and you'll find all this information in Article 7. However, language or speech impairment is actually two very separate disabilities, because there are different criteria for what a language impairment is versus what a speech impairment is. And we'll go over every one of these in some detail so that you have a better understanding of exactly what kind of student might qualify for these different areas. So we're going to start with autism spectrum disorder. So I want to acknowledge that what I have on these slides is either straight out of Article 7, meaning copy pasted definitions, or summarized in a little bit less technical terms, but it is all based very much on what Article 7 says. So with autism spectrum disorder, there are some key pieces of this to understand. It starts out in the definition by saying this is a lifelong developmental disability. Despite what Jenny McCarthy will tell you, autism does not get cured or go away. Now, we can make huge differences for students that helps lessen the effects of their disability. But if it is truly autism, it doesn't suddenly appear and it doesn't go away in its entirety. Generally, you can see it in most students even before they turn 3. That's not true for everyone because it is a spectrum disorder, which means there are varying degrees of how it shows up. And for some students, some of the things that it shows up in, or some aspects that it affects, aren't things that you're seeing in younger kids as much, such as language. You know, we don't expect as much language with little kids as we do with older kids. And so sometimes the social language effect that we might see may not really evidence itself until later. It significantly affects the student's verbal, nonverbal, or pragmatic, which is kind of the social language communication skills, social interactions, and it adversely affects the student's educational performance. Now, you're going to see this show up in every single eligibility area. Adversely affects the student's educational performance. It's part and parcel of every disability. If it doesn't affect your educational performance, and we'll talk more about exactly what that means kind of at the end of today, then you don't need specially designed instruction and you would not qualify for an IEP. So there are plenty of kids out there who have different diagnoses and different medical issues, you know, all sorts of things. But if it doesn't affect what's happening at school, then special ed is not the answer. They may qualify for some outside supports, outside therapies, but that does not necessarily mean that they need an individualized education program. Now, it goes on to get a little wonkier because it says that autism spectrum disorders include autistic disorder, Asperger's syndrome, and other pervasive developmental disorders, as described in the current version of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, which you probably heard people refer to the DSM, and that's what the Diagnostic Statistical Manual of Mental Disorders is. The problem is the DSM changes every now and then, and Article 7 changes every now and then, but they're not in sync. So things like autistic disorder, Asperger's syndrome, PDD, NOS, there are lots of those different diagnoses out there that don't actually exist anymore. Pretty much everything is called autism spectrum disorder. And so you may hear some of these terms, but it's a little dated because the diagnostic criteria and labels have changed over time. But that's okay. This is written so that when those things changed, we just change with them. Whatever is current in the DSM is what we're going with as far as kind of how things are diagnosed. And we're not actually making a diagnosis when we evaluate for a disorder. We're looking at, do they meet the criteria? And how does it affect things that are happening in school? So we sometimes will have a student who does not have an outside diagnosis, but they qualify. Or we may have the opposite, where a kid has a diagnosis of autism from somebody out there in the outside world, but we don't see the impact or we don't see it happening in school. It goes on to say that in order for us to apply this label, to say that a student has autism spectrum disorder as an eligibility, we're not going to use this if the primary reason, and that's an important word here, if the primary reason is because they have an emotional disability, blindness or low vision, deaf blindness, or an intellectual disability. But to keep clarifying or muddying, whichever you want to think of this as, you can have those other things and also have autism as long as you see the characteristics of autism standing out more than you would typically for one of these other disabilities. I'll give you an example. There are some students that qualify as a student who is blind or low vision that have certain kinds of visual deficits that make it so that they don't have eye contact, or they may have some sensory movements, but that's expected for that disorder. And so what we don't want to do is jump to conclusions and say, well, you know, this kid doesn't make any eye contact, and so we think it's part of autism. We have to look at the whole package, and we have to make sure that we can hold autism separate from these other disability areas in order to say that it is there. So just to kind of boil this down, a student can have one of the other disabilities and also be eligible under autism spectrum disorder, but only if we can sort out that it's not the other things just causing these kinds of behaviors that we see, that autism can stand alone kind of by itself. Also remember that a diagnosis doesn't automatically mean that you qualify for an IEP. We have to look at every case individually, and we have to make sure that a student has is showing evidence of that adverse educational performance. All right, the second category is blind or low vision. We used to call this a visual impairment. And it is an inability to use your vision for learning that also, again, you see it again, adversely affects educational performance, even with the best correction. So before I got LASIK years and years ago, if I took off my glasses, I couldn't walk across the room. I was so nearsighted that there was no way I could do anything without glasses or contacts. However, when I put on my glasses or put in my contacts, things were fine, right? So we have to make sure that we are not placing a student just because they needed glasses and they didn't get them. You have to look at, with the best correction that can be provided, what does a student's vision look like, and how is it affecting their learning? This also applies for students who have a reduced visual field. Maybe they can't see in the periphery, or maybe they can't see in the center, but they can only see in the periphery. There are so many different kinds of visual impairments, and I am certainly no expert on this, which is why we get certain kinds of evaluations as part of a blind or low vision evaluation that does bring in the expertise for that. All right, so you'll notice from the original list that all of the eligibility areas in Article 7 are in alphabetical order, except this one. And that's because we have changed names in the last few years. Previously, this category was called cognitive disability, so it fit right in right after the B's. Now it is intellectual disability, and it wasn't changed in the order in Article 7 just because it would have really changed pages and how everything was laid out. So when a student has an intellectual disability, they've got significant limitations in their intellectual functioning. So we're talking about their cognitive skills or their IQ. And typically that is having a standard score that is below 70. Now, we also have to have limitations in adaptive behavior, and adaptive behavior is like your daily life skills, your communication, social, motor, things that you need to be able to basically operate on in the real world. So not just the school stuff, not just the thinking stuff, but also some of the other skills as well. Part of this is that, or part of the pieces that we have to look at is is this long-standing? Meaning, this is something that occurs during the developmental period. That one's a little fluffy, I guess, because the developmental period, most people will tell you that kids are in chronic stages of development, even into their early 20s. But what this is trying to get at is that if I have an IQ that is average or low average, and then the next year you test me and my skills are in the 70s, and then the next year you test me and my skills are now in the 60s, it may not have actually been an intellectual disability. It may be something else. Either I just am not performing on the test and I'm not putting in any effort, or it could be I've had exposure to lead. It could be that I've had drug use that has caused diminished intellectual functioning. There are a lot of different things, but basically what this is saying is that this is typically something that you are born with. Yeah, sorry, my mind went kind of down a different track there. The same criteria for all the others, that adversely affects educational performance. And then we typically will take a student who has been identified as having an intellectual disability, and just to describe it a little bit better, they identify the level of disability. So a mild intellectual disability, a moderate intellectual disability, or a severe disability. And those are kind of parceled out based on how far below 70 are you. And so you can see what those numbers are, because they tend to kind of align with certain skill sets. Not always, though. There are some students who may have an IQ score that is in the mid 60s, and another student with an IQ score in the low 50s that may actually be doing better in some ways than a student that had a higher IQ score. Because we have to look at the whole package for a student. How are they performing with their adaptive skills? What is their communication like? So we don't jump to programming based on an IQ score. We always look at the entire package of a student to try and figure out what would be the best way to support their needs. So bottom line is, a student has to have below average intellectual skills, so below 70. They also have to have some deficits or limitations in their adaptive behavior, but that's not necessarily below 70. And it's not necessarily across the board. Some students have, very strong motor skills, but have very weak communication skills or self-care skills. Keep in mind that every kid is a mixture of strengths and challenges, whether you're talking about your highest performing student at school or your lowest. Every kid has got some strengths. So make sure that we don't overlook some kids who actually would qualify for intellectual disability, but we think that maybe they shouldn't because they've got an area that's near average. There are many rote skills that our kids with intellectual disabilities may do very, very well with. Basic word calling, memorizing math facts, sometimes even spelling, self-care skills. Every kid has to be looked at again through that whole picture of what do they need and where are their strengths and deficits at. All right, next category is deaf or hard of hearing. It used to be called a hearing impairment, but it still means the same thing. Nothing really changed in the definition. Now this is a little different because when we look at blind or low vision, it says if we can give you correction and that does the trick, you don't qualify for services. It's a little different with deaf or hard of hearing because it says it's a disability that with or without amplification adversely affects the student's ability to use hearing for developing language and learning, educational performance, and developmental progress. It also is a little bit wider in scope because some things are, some hearing impairments or hearing losses are permanent and some are fluctuating. Sometimes we have kids who are so chronically stopped up that there are days that I don't hear any instruction and days that I can hear just fine. So it could be something like that. It can range from mild to profound. It could be in one ear or it could be in both. And then they also want to recognize that we have some students that may use spoken language, some use sign, and some use a combination. So it is a very broad category. And again, not an expert in working with students who are deaf or hard of hearing, but there are many people out there who are. We have the Center for Deaf and Hard of Hearing that is amazing and can give a lot of really good input or help with evaluations. But we also have really good DHH teachers and speech pathologists who have good information and can help connect with the right supports needed for students in this category. So lots and lots of different kinds of hearing issues that could qualify in this area. Now, one of the things that you're going to see very rarely is students who qualify as deaf-blind, which means this is a student that has both hearing and vision issues that causes significant communication and adaptive behavior deficits. Notice it doesn't necessarily say that these are students that have cognitive or intellectual deficits, because many students, while they may have some issues in those areas, I've known many students who are deaf-blind that are strong in their thinking, and that's a real strength for them. The reason that they have this category, rather than just identifying a student as deaf or hard of hearing and blind or low vision, is because when you have a student who is both to some degree deaf and to some degree blind, their needs typically are different or greater than those programs individually. They just have some really unique needs. And so it's important that we get them connected with those services and program in a very individualized way. Right, developmental delay is a category that is typically used at preschool, but not always anymore. Developmental delay is a category that used to only go until a student was eligible to go to kindergarten, and it has been increased to cover kids through the end of the year that they are 8. So when they turn 9, this category no longer applies. Developmental delay means that I've got a big delay in at least one developmental area, so scores below 70, or I have moderate delays in at least 2 areas. So, 1.5 standard deviations below the mean would be about 22 to 23 points below the mean. So you're talking about, lower scores, but not quite as significant as being those 2 standard deviations would be scores below 70. The developmental areas that we look at when we evaluate a student, and we're looking at lots of different things when we do evaluations, but you could have a delay in any of the following areas. So gross or fine motor skills, cognitive, which is intellectual, receptive or expressive language, social or emotional development, and self-help or other adaptive areas. Notice that this does not include academics. This is not a category where we think a student might have a learning disability. This is a student that's just behind in one of those areas of development, which is why it really becomes very appropriate for most kids who are at the preschool age. However, because it has been extended, we sometimes do see kids evaluated for this area in kindergarten or even first grade. The problem is it's going to disappear when they turn 9. So we have to make sure that we're doing thorough evaluations. So if we're doing an assessment for this at elementary, it's always a really good idea to do a good look at their academics as well, even though it's not a requirement. And making sure that no matter what the student's age, that we take a broad enough look, and we do this with every student, regardless of what we're looking for, but we take a broad enough look when we're evaluating to consider if there is another eligibility area that is more appropriate. So for example, if I have a student that clearly meets the criteria for an autism spectrum disorder, to me, in my mind, that is what we should go with. If I have a student that clearly has an intellectual disability, and no matter what age that we're talking about, then that's what we should go with. If I'm not sure yet, and sometimes that happens, and your psychologist and your speech pathologist will probably tell you the same thing, that there are some times where we're like, oh, I don't know. They're kind of sitting right on that area that's gray, that maybe they are, maybe they aren't. This is a great category to go with, to give us time to work with the student and to gather more data. And then at some point we would reevaluate for that. All right, emotional disability. Emotional disability is when the student has an inability to either learn or progress that can't be explained by something else. And this says by cognitive, sensory, or health factors. So it means that we take a look at these other areas, and if they can't explain why the student is struggling to learn or progress, then it could be an emotional disability. They have to have one of these 5 characteristics, and they go on to explain that it's not just that I have one of these 5 characteristics, or maybe even more of them, but I've had it for a while. So it says over a long period of time, and it doesn't tell us exactly what that long period of time is, but it is a long period of time, and to a marked degree, which means that I stand out in some way from my peers. I stand out on rating scales. Typically, you can walk into a classroom and you can see a difference between the student that you're considering for an emotional disability and their peers. And it adversely affects their educational performance. But we're looking at 5 different areas. So one is a tendency to develop physical symptoms or fears associated with personal or school problems. These are your kids who, you know, they're crying all the time. Mom's dragging them out the door to try and get them on the bus. They're crippled with fear about going to school. They're having separation anxiety. It may be a lot of different things that can lead to this physical problems. The kid who's throwing up because they're so worried about leaving home and going to school. 2 is a general pervasive mood of unhappiness or depression. Now, again, this does not mean that anybody at the school or anybody who's involved in the evaluation is giving someone a diagnosis of depression, but what they are doing is using the diagnostic criteria as they talk with the student and have parents and students and teachers completing rating scales to see, do their symptoms of depression stand out against a typical peer. An inability to build or maintain satisfactory interpersonal relationships, and that could be with peers or that could be with adults. But this isn't just that I'm being obstinate, and this isn't just that I don't like coming to school and I don't like my teacher this year. This is a chronic kind of thing where a student is really struggling with that interaction and developing and maintaining those relationships. Inappropriate behaviors or feelings under normal circumstances. And I think this is probably the one that gets most misused, I guess, because it's not just inappropriate behavior. We got a lot of kids in school who have inappropriate behaviors, right? This is why we have rules and we have discipline and we correct that inappropriate behavior. But it's inappropriate behavior or feelings under normal circumstances. Total meltdown over tiny things. Bursting into tears because I was told I lose a point on something. You know, you're looking at things that really stand out as, that's not the way other kids react. This also means that, you know, if I lost someone in my family, say I had a parent that passed away or something like that, I'm going to have some depression. I would expect that, right? I would expect if my favorite activity got canceled or, you know, my mom who was supposed to pick me up for the weekend didn't show up, I'm going to have some behaviors or feelings that would be expected under the circumstances. They would not necessarily be inappropriate. And then the fifth area that can be a characteristic is episodes of psychosis. So kids who are hearing or seeing things that are not there and that is consistently interfering. We don't have that very often, but we do occasionally get kids who go into periods of psychosis, and you're very likely going to have some outside providers involved if you're qualifying a kid in under this particular area of an emotional disability. All right, language or speech impairment. So to start off, when you read this in Article 7, it starts off talking about language or speech impairment that is kind of broad and as if they're one and the same, right? Then it goes into some very specific details about how they're different. So we're going to start with talking about the broader category. So language or speech impairment, this includes language impairments and speech impairments, again, that adversely affect educational performance. So if there's no impact on educational performance, then I don't qualify in this area. So we have to make sure that we're looking at how do these things affect my ability to be a student and be functioning at school. So it clarifies that if I am a student who English is not my native language, we've got to look at this kind of through a different lens. So this falls back on not only our speech and language pathologists, but also a lot of times they have to work pretty closely with your EL person in your school to find out some of this stuff, because there are so many things about other languages that I certainly wouldn't know. So when there are speech or language patterns within that native language that are different from English or that are part of the dialect of my native language, then it may not be a speech or language issue. It just may be that, you know, I don't want to fall into stereotypes, but you can think of examples of somebody who came from a different language initially that have trouble pronouncing certain sounds in English because they don't exist in their first language. And so it takes a little detective work for your SLPs to figure this out, but they are really good at this because they run into it every now and then. So we have to look at their language and their speech. And if there is an impairment, it needs to be an impairment that you can see both in English and in their native language in order for it to fit the criteria under language or speech impairment. So we're going to start with language impairment and kind of differentiate this a little bit. So language impairments are big, right? There are so many different kinds of language impairments. Comprehension or expression of spoken or written language that results from either organic causes or non-organic causes. So it could be different things that led to this in the first place that are non-maturational in nature, meaning little kids don't speak in complete sentences, right? They misuse pronouns. They sometimes use words wrong. We expect that from our toddlers. And as they get older, we expect that their language matures. So what our SLPs are looking for are things that are unusual based on a student's age and developmental level. These are things that affect the primary language systems in one or more of these areas. So word retrieval, being able to, try to come up with the right word, phonology, morphology, syntax, semantics, and pragmatics. So a lot of different areas, which is why when your speech pathologist does an evaluation, they're not just assessing vocabulary, they're looking at language from multiple angles to find out where, if any place, this student is struggling, because that tells us then what we're going to do to help support the student. Now, when we have students who are deaf or hard of hearing, or students who are identified as having specific learning disabilities that also have language deficits or issues with auditory processing, basically what this is saying is what we're not going to do if they have other disabilities is just stick them in language supports. So we're not just giving them language supports. If they are identified as having these other areas, that we need to also consider what services they need for deaf and hard of hearing and for specific learning disabilities. Now, speech impairments are different. And again, speech impairments are very broad. There are lots of different kinds of speech impairments. This could be fluency, like stuttering, articulation, being able to pronounce the sounds, voice disorders that are, again, non-maturational, right? We know little kids have trouble with certain sounds. They grow into learning certain things over time. But there hits a point where that should have cleared up. And that's when your speech pathologist will say, ooh, I think we need to take a look at this. They may need some support. And sometimes these are also things that are related to the actual oral structures of the mouth. We have sometimes kids with cleft palates, that are tongue-tied. I'm sure there are lots and lots of different things out there, and talk to your speech pathologist about these different things. But there are sometimes that it's actually the physical structure of the mouth that can cause different kinds of speech impairments. There is a category called multiple disabilities, and it's kind of a unique category. It is not just that I have more than one disability. That is not what multiple disabilities is for. These are kids that have some pretty significant needs. So by nature, it is that the student does have more than one disability. One of them has to be a significant cognitive disability. And these are things that are not going to go away, that interfere with me being able to be independent. And it's really difficult to figure out what's causing what. Like when a student has significant intellectual needs, significant medical things going on, and maybe also has significant needs with their motor skills. They may have, some orthopedic stuff going on. And for a lot of kids, we can determine what is the primary disability, right? When they have more than one disability. But with multiple disabilities, it's like, I'm not sure. Is it the intellectual functioning that's causing the most problem, or is it all these medical things going on that are causing more problems? It's when you're you've got a muddy mess of, I'm not sure which one is really having the most impact, that multiple disabilities is a good category for kind of describing that. The only thing that it really doesn't fit with are students who are deaf-blind, because yes, I have deaf or hard of hearing and I have blind or low vision, but deaf-blind is its own category. So we don't use multiple disabilities to describe deafness and blindness as that combination. Other health impairment, I feel like I'm saying this for every disability area, but really every disability eligibility area that we have, there is no typical kid, because there are so many different things that can fall into that category. And the old saying, if you know one student with other health impairment, you know one student with other health impairment, because every kid is going to be different and they can get into this category for a variety of different reasons. So the definition says that in order to qualify in this area, you have limited strength, vitality, or alertness. So that's where we start. So either strength, meaning, physical strength. So I have a weakness of some sort. Vitality, just, being able to stick with it because I fade out over time. Or alertness, which can also include being overly alert to environmental stimuli. The light's buzzing. There goes my attention, right? Somebody just walked by the classroom window. Oh, there's my attention. Sometimes I'm alert to everything but what I should be alert to. And sometimes it's just I'm under alert to everything. So that's one piece. I've got to have that piece. It has to be due to chronic or acute health problems, which is a wide variety of things, and it has to adversely affect my educational performance. So they give some very specific examples in Article 7 of asthma, attention deficit disorder. They say attention deficit hyperactivity disorder and ADD separately. That's another place where the diagnoses have changed. There is no ADD anymore. It is all attention deficit hyperactivity disorder. And then they just have specific types. Doesn't matter. We'll take them, right? Diabetes, epilepsy, heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell, Tourette syndrome. But they clearly say this is just some examples. This is not the exhaustive list. But what we have to think about is it a health condition? And it says it can be chronic or acute. So, we don't want to ever put a student into a special ed program that I have something that is temporary, right? That's going to go away in a few weeks. But we have some things that, boy, we hope are going to go away after a certain amount of time, but we don't know, right? So a student who is maybe going through cancer treatment, it's probably going to be quite a road, but we hope at some point that condition may be taken care of and they'll be back to even keel, but we don't know that. But we know it's not like a cold that's going to go away in a week and you're going to be your old self again. So again, we have to have that impact piece, and it has to be due to chronic or acute health problems. So again, having a diagnosis does not necessarily mean that a student is eligible. If I don't show don't show limited strength or go back to this, vitality or alertness, then it's not other health impairment. If it does not adversely affect my educational performance, then it's not really other health impairment. It may be something that we consider under a Section 504 plan, but we have to meet all the criteria of this in order to be considered for other health impairment. The other piece to know about other health impairment is, of all of the things that we have to collect as part of the evaluation process, it tells us that we have to look at the available medical information that is educationally relevant. What that doesn't say is that we have to have a written diagnosis. Now that kind of leaves us in a slightly dangerous position, because if it is a student with attention deficit hyperactivity disorder, I know the criteria. I can assess for that probably better than a lot of family doctors could who haven't had that experience, right? So your psychologists are well versed in looking at something like ADHD, which is probably your biggest referral source to this category. However, I can't tell you whether a student has asthma or not. Only the student's doctor can. But there are times when you may have a parent who's saying, my child has this condition, right? And you don't doubt it a bit. It really is kind of left to the district to say, well, do we need this piece of paper signed by the doctor, which we may or may not be able to get, that says that a student clearly has this condition. If we don't doubt it, then and we know that the student needs the assistance, and we believe that the student does have this condition, there's nothing that says that we have to have that. Now, if your district says we absolutely have to have medical documentation, then we run the risk of your district having to pay for that medical evaluation in order to obtain that. Now, if it exists and a parent will just give you that, that's great. But we have to make sure that we're sticking to things that we're qualified to say, yes, it exists, or no, it doesn't. And that we're trying our best to get that medical information, but we're not necessarily requiring it. All right, orthopedic impairment, these are physical disabilities. In this case, you would have to have a condition that would cause a physical disability that, again, would adversely affect educational performance. Not necessarily affect my thinking, may not even affect my academic performance, but may affect my educational performance in my ability to get around the school. And I mean, there could be a lot of different ways that this causes an effect on me. It may just be that my strength doesn't hold out for part of the day because of the physical thing that's going on. Again, they give you some potential areas that could be included, but this is not an exhaustive list either. So it could be something congenital, or it could be a disease like polio or bone tuberculosis, or it could be something else that was not a congenital thing and was not a disease, but was just a circumstance such as cerebral palsy, having an amputation, fractures or burns that cause contractures. Most likely, if you are assessing a student that has an orthopedic impairment, you're going to have your physical therapist involved. This tends to be on a bigger motor level, but your physical therapist and then often your occupational therapist as well will be involved in these kinds of evaluations. Specific learning disability, boy, there are a lot of different kinds of specific learning disabilities. This is a disorder in one or more of the basic psychological processes. So these are like all the different ways that we think and process information. that are involved in understanding or using language, spoken or written, that adversely affects a student's educational performance. Clear as mud, right? Not so much. I really believe that specific learning disability is one of the hardest areas to feel confident about whether a student qualifies or not. But we do it. We figure it out. So you're going to see a specific learning disability when a student is either not achieving adequately for their age, or to meet the standards that are there for that grade level, in one or more of the following areas. And we're going to hit all these areas. When provided with learning experiences and instruction appropriate for my age or grade level standards, which means I got to get good instruction first, right? If I don't have good instruction and I'm having problems, I would expect that. If we're not doing, we don't have good core educational programs, we're going to see a lot of students struggling, and it's probably not due to disability. It's probably due to we need to change the instruction. But we still have students who, even though they're getting the good stuff, they're still struggling. And they could struggle in a lot of different areas. So one area is reading disability. And this can take a variety of forms. You'll notice that all of these different disability areas say that they are neurological in origin, which is, again, partly to reflect that that it's not because of poor instruction, right? And it's not because of lack of instruction, meaning I haven't shown up to school for the last 30 days. Well, you're going to struggle when that happens. But it's something neurologically. It's one of my processes is kind of putting up a roadblock saying, we're going to make you work a whole lot harder to get to where you need to in order to obtain that skill. And there is a continuum of severity. We have kids who are more on the mild end of having a disability, and some that are more severe. It could be dealing with reading accurately, reading fluently, and we may see some decoding or encoding or spelling difficulties. It may be in your basic reading skills. It may be in your reading fluency skills. It may be in reading comprehension. Dyslexia is one of those terms out there that I think gets a lot of schools in hot water. Dyslexia is simply a very specific type of reading disability. And if we have a student who has been diagnosed somewhere with dyslexia, we still look at it to see whether or not they might qualify for a specific learning disability in the area of reading. And we dig deep into those skills that are associated with dyslexia. We have some students who qualify for a specific learning disability in the area of written expression. And written expression is a difficult thing because you're talking about having language that is connected to written language, thinking about the language, and you have to have the motor skills to be able to get it from here to here and make it happen on paper. There is so much involved in writing, and we know that writing is one of those areas that a lot of us struggle with supporting in schools. But we have some kids who can read beautifully, they can do math, and they can tell you a story to write, but you ask them to get it on paper and whew, it's hard. So we're looking again at the processes involved in thinking, the psychological processes, and how they affect your ability to write. Math disabilities, which could be a lot of different things. It could be related to calculation. It could be related to problem solving or reasoning, because again, there's a lot involved in math. And sometimes math is complicated by writing and by reading. So again, very complex, but we're looking at different kinds of math skills and how that plays out with students. And then there are two areas that are related to language. And again, the thinking here is that we have a language impairment, but we also sometimes have students that have, because of one of their psychological processes, have it show up in their oral expression or their listening comprehension that is used in their learning. So with an oral expression disability, it's when a student is using that expressive language, so how they express themselves using language in order to mediate their reading, writing, spelling, or math. So how does my language affect that? So typically, whenever we're looking at this area for specific learning disability, your school psychologists are going to be involving those speech pathologists as well to make sure, is it language? Is it specific learning disability related to one of the language areas, or is it both? And then the other is listening comprehension, which is it's kind of the flip side of that. It's using receptive language in order to read, write, spell, or perform math skills. Now, the area of specific learning disability is one that has a lot of things that we have to rule out that might be a potential cause. So we don't call a difficulty a specific learning disability if what we're seeing is because of the student's vision, hearing, or a motor disability, right? If I have a hand that's not working and I can't produce writing, it is not a writing or a written language specific learning disability. It may be an orthopedic impairment, right? It would be something different. We also know that specific learning disabilities are not the same as intellectual disabilities. So if my IQ is lower, then it's not a specific learning disability. Usually my academic deficits are kind of not expected necessarily, but typically hindered by my overall intellectual processes. We also have to rule out whether or not an emotional disability is causing the difficulty. And again, not that a student can't have an emotional disability, they can, but it can't be that my emotional disability is keeping me paralyzed with fear at home and not getting to school. And because of that, I'm not getting the instruction. And so I'm having trouble with my academic performance. Cultural factors, and this could be a lot of things. This is kind of an area that's not really well defined, but one example might be that maybe I'm raised in a culture that does not value writing, and I'm not asked to write. Maybe my parents or my belief system does not believe that the written form of language is important. Then if that would explain away why a student's having difficulty, then we would not call it a specific learning disability. We always have to be very careful with these areas too, to not read too much into what's going on or at home or in a student's culture, because it still could be a specific learning disability. Again, I feel like we're always playing detective work here. Same with environmental or economic disadvantage. If a student is chronically underfed, lacking in sleep, doesn't have any books at home, doesn't have anybody to be able to read to them at home, and they're struggling with reading, it may be because of that. This just really forces us to look at these factors and see how much they might be playing into them. Again, it should not be something that we say, oh, this student comes from an environment that maybe is not the best, so we're not going to place them in this category. It just really has us look at these things and see what kind of impact those things might have. And it also gives us an area that we might be able to support more, either prior to an evaluation or even after. Limited English proficiency, again, we have to rule out the effects of that, and then lack of appropriate instruction in reading or math. You got to have the good instruction to know whether or not that could be the potential the potential contributor to the problem. And then the last one is traumatic brain injury. And traumatic brain injury it's an acquired injury, which means it's not a birth injury. It's not, I was born with part of my brain maybe not fully formed or something like that. It's something that happened after that is caused by an external force, right? So I'm hit somehow, and it could be an open wound. It could be a closed head injury. It doesn't matter, but it's some kind of external force that results in either complete or partial functional disability or psychosocial impairment or both. And it can really affect kids in many different ways. It can affect their thinking, their language, memory, their attention, their reasoning, their abstract thinking, judgment. It's a long list. Problem solving, sensory, perceptual, motor abilities, psychosocial behavior, physical functions, information processing, and or speech. Whew, it's a lot of stuff. In most cases, what you're going to have with a student with a traumatic brain injuries are some lovely outside reports that help us get a better sense of what's going on with a student, because many times these students will have been hospitalized, not always, but it may be from an accident or something where a student has gotten some evaluation while in a hospital kind of setting. It specifically rules out, again, those congenital or degenerative kinds of conditions. There are some things that you're just born with, or some things that are disease-based, or some kind of other disorder where things are going to degenerate over time, or birth trauma. So we do have we have some students who maybe had an injury to the brain because they went without oxygen at birth or as part of the birthing process. That does not fall under this category. It may very well fall under a different category, such as intellectual disability or orthopedic impairment for a student with cerebral palsy that has some significant physical things going on. So, or it could be that the student had something happen at birth, but yet they don't qualify as a student with a disability because it's not affecting them to a significant degree. We do want to make sure that special ed is special, and special ed is not entered into lightly, that we give students the supports that they need, but sometimes that support comes from general education because not everybody has a disability. So as I'm kind of wrapping some of this up, I want to talk about some things that are kind of cut across all areas. So specifically, I've repeated over and over again, every single area contains the qualifier that the disability must adversely affect educational performance. Well, if you look up educational performance or adversely affects educational performance in Article 7, it says that students should have a consistent, or the disability should have a consistent and significant negative impact on their academic achievement, functional performance, or both. So I want you to kind of hold those separately first, because we think in terms many times of academic achievement. How is this affecting your reading, writing, and math? But functional performance, when you look up that in Article 7 in the definition section, it's a very broad area. It could be social skills, it could be behavior, it could be communication, it could be employment skills. I mean, it gives like a long list that, again, is not necessarily comprehensive. We're talking about a lot of areas that something could affect me in my ability to be a student. So if I can't get along with other kids and I'm constantly being kicked out of class and I can't form friendships, but I can blow the lid off the iLearn test, that doesn't necessarily mean that I'm not eligible because my functional performance may be significantly impacted. So I want to show you, this is a form that I sometimes use not as part of an IEP, but as part of explaining and discussing adverse educational performance at a meeting. So I want you to kind of take this with a grain of salt, because this was one district's efforts in trying to put this into a way to understand this. If you scan the QR code, you'll be able to see an example of this. I think it's in the eligibility, determining eligibility column on this Padlet. But you can take this and tweak this form to make it fit your needs, because this, again, was one district's interpretation of that. But in academic achievement, giving somebody a way to look at, okay, here are the different pieces of data we have that says there's a little bit of impairment, there's a lot of impairment, there's a ton of impairment. And then also looking at things like functional performance. So your physical skills, your personal care skills, your social emotional adjustment, having data pieces that say, okay, I don't really see an impact here, or maybe I do, right? This is just one way that you could potentially look at that area of adverse educational performance. But we want to make sure that, again, we are not sticking to just academics, because that's not what the law says. Educational performance includes both the academic and the functional performance pieces. So just important to know that. So I appreciate your time, and I hope the rest of your training day is good as well. We do have lots of free trainings at the IEPTA Center. So if you scan this or go to our website, you can find free trainings. Some are virtual, some are in person in a variety of locations on different topics. This is my information, so please feel free to reach out to me if you have any questions. I'll get back to you as soon as I can. And then this is just a little bit of additional information about different ways that you can connect with the IEP Technical Assistance Center through social media or through our main office. So thank you very much. And I look forward to any questions or comments that you might have.